Here I'll give you a 7 steps and 7 areas to check for asymmetry. So whenever you feel like, whenever you're getting an ankle sprain, right, you feel like you're twisting only your ankle. No, when you twist the ankle, as you can see, the whole chain from your knee, your hip and your spine are getting affected too. You fall down from the chair, there's a startle reflex. That means your hands open up and your body tends to contract, right? So it's not only the falling down from the chair. Even though the event is gone, you have fallen down, you have gotten up, but your muscles are tensed after those falls. It can be your paraspinous muscles, your front muscles, it can be any areas. So I'll give you the 7 areas which you can work on it to get influence in those areas. So first step, we'll be checking our armrest and see which goes more compared to the other one. So whichever side feels easier, so I want you to take that hand towards the ceiling and behind, towards the ceiling and behind. Hold it there for 20 seconds, or you can do a 20 up and down. So whichever side is free. So first area is the shoulder we're checking, okay, the armrest. It can be abduction or the flexion. Other ones are there for tucking behind, shoulder, all those things I'll show you. Those are in next level we do it. So all the knee, even the eye movements, the tongue movement, jaw glide with tongue movements, with ankle. So these are the combinations. These are next level one. Those are starting ones I'm giving you. First you're checking the hands, okay, left and right, whichever feels easy, you're gonna do that side. Second will be your tongue rotation. You'll just see which side you're able to go more. Whichever side you're able to go more, you'll force on that side. You can do it each time when you're coming back. You can do 2 sets of 20 repetition or 10 to 15 repetitions. It depends how conditioned you are. If you have not been doing exercises, so do it for 10 repetitions or 2 repetitions for 2 sets, okay? 10 repetitions in this way you can do, or either you can do a hold. Whichever side you can go further, you have to do the exercise on that side. Okay, in here we are using the good side. Second will be our leg raises. So you'll go and lift and see which side you're able to lift. So whichever side you're able to lift, you will be lifting and holding it there for, again, 2 sets for 20 seconds in this way. Or if you're not, then you can just swing it up in this way, okay? Or you can check for the abductions in this way. So whichever side goes more, you'll be holding it on that side, okay? So you'll see most of the time you're doing the exercise on the lower limb, it is decreasing the pain on the shoulder, or it vice versa. If you're doing it up, so there's a chain. So the fascia chain comes from here, the obliques, it goes down to your this thing. So there's a obliques, the cross-sectional chains of fascia. So one fascia is coming here. So if I'm doing the exercise here, it's influencing my hip also in this way. And the fourth area which you're gonna see is, you're gonna check for the single leg stand. And you're not allowed to touch the leg on the ground, whichever side you're testing. So whichever side you feel easier to get up, so you'll choose that side. Suppose I'm taking my right. If you want, you can increase the height of the chair, then you can start. And do it 10 times, 2 sets, up and down. And after doing this, you can see, go and observe. If you're having neck pain or any shoulder pain, just see if there's causing any changes. If it's causing any changes in pain, it is coming down, or if not in pain, if range is improving, do it more. So even this also for 2 sets, 10 repetitions, or 2 sets, 20 repetitions. It's up to you. Or you can do a hold. So I'll be standing here. So my toes will be pointing towards me. And I'll be going and touching my heels forward. All the load will be on this knee. And just check which side feels easier. So whichever side feels easier, that's why I'm going to do 2 sets of 10 repetitions. So each time I'm going to come and check for my any shoulder pain or back pain or any range issue you're having and stuff. Okay, I'll give you a bonus. If you have neck pain, you have to be in wide stance and be in sumo stance. See whichever side you're able to stand more, that side you're going to stand. How many seconds? It's up to you. 20 seconds or 20 seconds to 10 seconds. You can do it for 2 sets. And after being in these positions, just try to balance, okay? Then after that, go and check your neck pain. How does it feel? So you'll be in the sumo stance, and again you go and check which side you feel better, stable. So that side you're going to stand, okay? So just do this and see how your body feels. And last one will be our push-ups. So I'll take this side and check which side feels easier. So whichever side feels easier, I'll make the person do 10 to 12 times. So these are the 7 areas you're going to check: the shoulder, the trunk, the SLR, the straight leg raise. Either you can do it on the sitting, if the toes will be pointing towards you, lift it up, whichever goes higher. Okay, and the fourth one will be our single leg stance, whichever feels easier you're going to do on that. And the fifth one will be our heel touch in this way, whichever side feels easier you're going to do. And the last one which I'm giving you is single-handed push-ups, whichever side is easier you're going to do. And after doing this, you'll see a drastic change in pain or range of motion. But it's not like after seeing the motion and getting all the pain come down, but you have to continue. Whenever throughout the day, whenever you feel like pain is there, just go and check for the symmetry. Okay, I'm feeling I cannot rotate this side, I'm able to rotate this side. So again, I'll go and check. It's not like 1-2 days you'll do. So this is like a constantly checking your body whether you are in symmetry or not, because the gravity is constantly pulling us. Even the fascia. Suppose I'm standing in this way. As you can see, one side is an anchor, one side is going here. So whenever you're taking a dog for a walk, you're not taking the dog for a walk. The dog is taking you for a walk. So it's that way. The fascia holds you in that way. Suppose, as you can see, this is the anchor, my body is going in this way. So as you stand in this way. So that's how our body is constantly getting pulled by the gravity in one direction. So to check, just go and check these 7 areas and you'll see quite improvement after doing this. Either you'll see decrease in pain or increase in range of motion. So I want you to do quite often. So there are other areas also. I use the tongue movements, the eye movements, even the ear movements. So there are various things we do. So those I'll show you in the next video. So for now, you can try this.